Aloha, Hawaii. It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Yep, coast to coast and border to border, well, at least in our state. Here in Hawaii, there are 4 vein clinics. Started actually on the Big Island, and Oahu was the last clinic. So it went from the Big Island, we got Kauai, we got Maui, and we have Honolulu. Dr. Juliff is the medical director, and we talk about venous conditions. We talk about all kinds of stuff, and we invite your participation by going online to veinclinicsofhawaii.com and hit the contact button and tell us what you want to hear in the program. A lot of what we do is sort of there's a method to the madness, because what we're trying to do is get programs that are complete about a specific type of venous condition and then get it up on the website. So if you're feeling like that, you can listen to it. You can also just go to the website and learn a lot on your own. And thank goodness for the internet. We'll talk about that. That's a big help sometimes. Sometimes it's not so big of a help. So what's today? Well, today is, I think, maybe the most frequently asked question of all. I know I used to ask it. We got veins and we got arteries. What are the difference? And if one's insufficient, is the other insufficient? So Dr. Juliff he's gonna unlock those keys. He's gonna just fling open this door, and we're gonna first of all make a definition of what these things are. First of all, maybe Doc, people ought to realize that you work on the venous system, and there's 2 systems. There's actually a lot of systems, but the ones that we usually talk about are arteries and veins. So the difference between them, every now and again, every week, we got to remind, what's the difference between an artery and a vein?
Well, the arteries carry blood from the heart, so the heart's pumping all day long.
Yep.
And it's pushing blood through the arteries, and that's how our entire body gets blood and therefore oxygen. I mean, that's what we live on. We live on oxygen, all of our body tissues. So that's the arterial system. The arterial system has to do
sends it out.
Yeah, sending blood out to all parts of the body. Veins, on the other hand, bring blood back to the heart. Now, blood, I guess the crucial difference there, and they look very different too.
Yeah.
I mean, when you look at them surgically, arteries are much firmer. The wall typically is thicker. Is just a much sturdier kind of blood vessel.
Is it because of the pressure that it's has to live with?
Well, exactly. Makes sense. It's a necessity because, those arteries are seeing or carrying blood, again, pumped by the heart, so it has to handle that increased pressure. Veins, on the other hand, are much thinner walled, and depending on what part of the body you're talking about, can be quite a bit bigger. When you talk about, or when we look at the major blood vessels, for instance, going down your leg, the veins that are in the similar location are quite a bit bigger, thinner walled, quite a bit more fragile. Huh. So they can be, when we're working on them surgically, we often have to be quite a bit more, I think, concerned about how we're handling veins.
Now, I'm going to guess, and I know we're going to get at this probably a little later on in this program, but if you have a insufficiency in one, you may have it in the other. But I'm guessing that if your arteries are pumping okay, that doesn't mean that your veins wouldn't be insufficient. I mean, you could have perfectly well working arteries. Everything's fine, but the veins aren't.
Oh, yeah.
No valves in the arteries, right?
Right.
I learned that. Boom. Thing number 1 I learned.
Very good, Mike. And that's the main difference. Yeah. I know back when I was, young in high school biology or whatever, I never really thought about this, but I'm sure that I assumed that blood moving through veins happened because the heart was pumping. Yeah. The heart, blood through arteries happens because the heart is pumping, but not so with veins.
Here's the picture that I tried to paint when I learned this a long time ago. Okay, so the arteries are doing their job. This wonderful, refreshed, filtered, oxygenated blood goes through the heart and goes zooming to every little thing in your body. At the very end, down at the bottom of the feet, they're really small.
Very small.
And there is no physical connection that I know of from the artery to the vein. So maybe you can tell what moves the little dribble that's left in the artery to get to the vein to start going back uphill?
Well, there is there's a pressure gradient that actually is seen through that. You're right. There's not a direct connection. Yeah. But it's somewhat of a connection through soft tissue and just cellular kind of pressures. Mm-hmm. So there is a little bit of a pressure, and there are other physiologic things going on that draw blood back into the the other side, the venous system. But then it has to move from there
all the way back up to the heart.
Yeah, all the way back to the heart. And after it gets into the the major venous vessels, it's not moving because the heart's pumping. Yeah. It's moving for because of other reasons. Now,
I'm thinking maybe is the ankle a pump? Is the knee a pump? I mean, something has to help this blood up the hill, doesn't it?
It is, yeah. And it's not the ankle or the knee, but it is it's the musculature of the lower leg.
Gotcha.
If we're talking about the legs now, the upper part of the body doesn't require as much help with movement of vein through blood through veins. It's sort of a dependent movement. It's kind of running downhill anyway. But the legs are particularly important to get the blood back up to the heart. There has to be other modalities that are helping that because, again, we spend most of our life in an upright position, and that blood is trying to move against gravity. So it really relies on two things: the musculature of your leg.
Okay.
And also one-way valves that we have in the veins in our legs that keep the blood moving up. So you mentioned other things in the leg. There are other things in the leg. It's muscle, and the calf muscle is often referred to as the calf muscle pump.
Pump, okay. And you can see that. You feel your calf. It's a big thing.
Sure. Yeah.
But, one would ask, I understand, and we've talked about this in the past, and we're going to continue talking about the venous insufficiency because of things that can not work right, like the valves, for instance, and you can get clots and everything else. But the artery, I didn't even know that there was such a word as arterial insufficiency because I'm thinking, what could be insufficient? It's a bunch of pipes that are carrying blood pumped from the heart downhill. What's the big deal?
Yeah, and the problem is completely different.
Yeah, okay.
Getting back to the veins, venous insufficiency just means that the veins aren't working properly. The same thing with the arteries, but the veins fail because those one-way valves fail. That's the crux of the problem. Okay, so what is the crux of the problem in arterial insufficiency? And basically what arterial insufficiency means is that there isn't enough arterial blood, getting to some part of the body.
Okay.
So same thing with veins.
Is that part of the body crying out for help?
Yeah.
Yeah.
It is.
Yeah, I need blood. What's up? What's going on here?
It becomes symptomatic.
Yeah.
So why does flow through veins fails because valves are failing? Flow through arteries becomes diminished because blockages occur. And those blockages are something that we refer to as plaque.
Yeah, and by the way, is in some areas, I'm guessing that the artery is kind of an inanimate thing. It's a pipe, although it's tissue. But it's a pipe. That must mean if you've got bad things in your blood, and that blood is coming down through those arteries, if you're a smoker or a drinker or a druggie or of all of these things, or you have massive infections, is the poor old artery equipped to handle any of that stuff?
Well, is it going to be detrimental to the artery? Yeah, absolutely. Yeah. So we talk about the risk factors of arterial insufficiency or of arterial disease. But there's a bunch of stuff that might be floating around the blood that are going to be harmful. For instance, if you smoke, big one. That's a huge risk factor for developing arterial blockage and arterial disease. Diabetes, we hear about that all the time. The vascular problems,
especially here in Hawaii. Come on,
Yeah.
It's like the national scourge. It seems sometimes.
Right. Obesity, a very common risk factor for arterial disease. Cholesterol, high lipid and cholesterol counts in your blood. High blood pressure. Age. as we age. Unfortunately, we're all aging.
Mm-hmm. By the way, you can add that symptom to everything we discuss.
Pretty much everything.
Yeah.
Pretty much everything. And then, of course, family history. Just similar to venous disease. If you have a strong family history of arterial disease, then it's much more likely that you're going to have it too.
Some of the things that you've mentioned obviously can be fixed pretty quickly. If you've got, that's why I think maybe if somebody is a reformed alcoholic, if a doctor gave him the scare saying, if you continue to do this, you are going to die. And so some people will actually be able to kick the alcohol habit because they don't want to die.
Sure.
So isn't there at some point in time when these big, strong folks that we're talking about, me and everybody else, is the doc says, you know what? You've been dodging a bullet, and you're not the kid that you were anymore. This is not going to work. You need to really address some of this stuff. And I imagine that sometimes a patient doesn't want to hear that stuff.
No, they don't.
Yeah.
And it's hard to change. People who smoke, it's very difficult for many of them to quit. Sometimes impossible, but often it takes an event to convince them. Like a major heart attack or a stroke or something like that.
Are you as amused as I am? I mean, they've come up with this. I don't know if it's an outright scam or a con job, but now people are doing this vaping instead of smoking because there's no nicotine. There's no carcinogens in the vaping like there is in the tobacco, but it's still got the nicotine in it. Right. And so I've actually been behind a couple of cars when I thought the car was on fire.
Yeah.
When 2 or 3 people are vaping in there and these volumes of stuff are going on. I don't think the jury's in on that yet. I think that probably is just as bad as smoking.
It might be, and you're right. Yeah, the jury is not out. There's a whole bunch of questions with respect to all of that. But yeah, they do. It seems like they do create a lot of smoke.
Well, but you see, that is replacing one condition with another. Mm-hmm. And so I'm guessing that the little victories that come along in your office, when somebody says, I actually went on a diet after you told me to, or I stopped smoking, aren't you able to see right away, well, guess what? Let's take a look at this ultrasound, and let's take a look at the other one. You have stopped deteriorating at the same rate. Something's going right with you for a change.
Mm-hmm. Sure.
Yeah.
Oh, absolutely, yeah. With respect to the symptoms of venous disease versus arterial disease, one of the symptoms of both is pain.
Okay.
So one of the questions is, doc,
is the vein hurt? Is the artery hurt? Which one hurts?
I've got pain. What does this do to? We always go back to the quality of the pain. The pain that people get with venous insufficiency is it's not real severe. It's kind of a nagging pain. It can be sort of throbbing. It can be a pain that gets worse over the course of a day, and again, that's because of the physiology. The longer through the day that we're standing upright, the more the blood is kind of pooling into our legs. And that can cause, discomfort. Okay, so what does and another distinction, I guess, is that typically when people get pain from venous insufficiency, often it's because they're standing up and they're not moving a lot.
Mm-hmm. Yeah, I was going to ask that, and I ask that every program. I know people that, for instance, we've spoken about this a lot of times. So if you're listening to it, don't think I heard this show because you haven't. Just this one part of it you are. A lot of us are deciding in later days and later ages to do something, to continue to work. Maybe it's some income driven, maybe it's just social, but you find out, I used to be a friend of mine was a dentist. And he retired. Now he does pass outs goods at one of the big box stores. But he's standing up. He stood up for 50 years as a dentist. And it's what stopped him practicing. He couldn't do that anymore.
Yeah. Well, and that's one of those professions. We see a bunch of dentists because they're standing in one position for a long time, just like hairdressers or pharmacists and that kind of thing. So typically, with the discomfort of venous insufficiency, if you walk, then that discomfort tends to go away.
Pumping.
Because the calf muscle starts to pump and relieves that the pooling of the blood that is occurring in the leg. So with arterial insufficiency, it's just the opposite.
Is that right? Wow. Okay, explain.
When we're talking about peripheral arterial disease, we're talking about the legs.
Mm-hmm.
And there are blockages in the arteries going down to the leg. Now, arteries carry oxygen.
Mm-hmm.
Our body works on oxygen, especially muscles. Muscles need oxygen to work. So as the blockage becomes worse and worse with time and many years of smoking and et cetera, at some point, that muscle in your leg is not going to get enough oxygen to work.
That was my crowning question. Okay, so the insufficiency of the artery means that the guys at the end of the line aren't getting their what they need. So they have to manifest a lot of things. Let's talk about maybe ulcers. Let's talk about skin changes and all of the things that happen if you're not getting that blood and oxygen.
Exactly. Yeah. So people typically this is the quintessential symptom of arterial insufficiency of the leg, and it's something that we call claudication. And claudication just means that when you walk, the pain starts.
Yeah.
So in sort of the distance that you can walk before the pain starts to occur is somewhat of a measure of how bad the arterial insufficiency is. Yeah. So with arteries, when you walk, the pain happens. With venous insufficiency, when you walk, the pain actually goes away.
Here's the thing. And when Dr. Juliff and I talk about quality of life and issues like that, we're talking about guys that can't go play around the golf with their buddies anymore. We're talking about guys that I had this guy. This is a great story. I wish this guy was still here. He moved back to the mainland. He was an internationally famous dart player. I mean, this guy stood up playing darts 4, 5, 6 hours a day. He was one of the best. And arterial problems stopped him from being able to do the thing that he, number one, loved to do, and he made a living at it. Couldn't do that anymore.
Mm-hmm, right.
And he said what happens was your concentration is when you're standing. And if you go sit down to get the pain off your leg and then you get up when it's your turn again, you're not warmed up,
So you're distracted.
Yeah, and so and you're worried more about the pain than the bullseye.
Mm-hmm.
So these are measurable things.
Right. Right. Yeah. Well, venous insufficiency as well as arterial insufficiency both can interfere with people's not only their quality of life but their ability to make a living and maintain a job and all that sort of stuff. But so what are some of the other symptoms? The skin of the feet start to look pale, more pale,
right?
Pale than they used
to be. The opposite of the venous disease, right? Where you get the leathery dark color.
Exactly.
So it's pale. Why? Not enough blood, not enough oxygen.
Right. Well, not enough blood, not enough oxygen, and limiting the blood flow to the skin, and the skin becomes pale. So the skin can actually become or start to look a little shiny. It's got a kind of a shiny hue to it. Just another one of those things that we observe. The legs in the feet start losing hair when there's not enough oxygen getting down there.
What is hair? Hair's protein, right? Hair's like a thing.
It needs oxygen to do their thing. Coolness of the skin. The leg can develop some numbness or weakness. Erectile dysfunction. Mm-hmm. Poor arterial blood flow is one of the causes for ED.
It's sort of interesting because it's like a whole nother set of problems that people are already dealing with. Maybe if they have both venous and arterial insufficiency, there's a whole host of things going wrong.
Oh yeah. Well, but the surprising thing is that often those two groups of people are very separate. Mm-hmm. Usually people have either one or the other. Most of the time, they don't have both.
Which is that's good to know. Well, and I'll tell you why. We've discussed this before. I'm a patient, not just the host of the show, and I'm dealing with it, and I'm being treated extremely well. I'm very grateful, but I must tell you that it is, that, and I haven't had any artery problems. They've been looked at and everything else. So I thought, well, maybe I'm just lucky, but it's almost kind of like two different systems, isn't it?
Oh, definitely. Absolutely. Completely different.
Okay, so when you're looking at this, the symptoms, they're almost a 180 from the symptoms of the other.
Yeah, in many ways, very much so. Yeah. So the pain, getting back to claudication, which is that muscular pain that we get or that people get with PAD as they're walking. Then it becomes a point where they can walk less and less before that pain comes on. Now the other kind of quintessential finding there or story is that the patient they walk a half a block, they have to stop because the pain gets so bad in the calf, but they stop, they sit, and it goes away.
I want to tell you, let me give you an example, and I've learned, I just twigged on this when Dr. Julep said this. And by the way, you got to get to veinclinicsofhawaii.com and look at all of these things with pictures. I mean, radio is the theater of the mind, but I'm going to tell you something. There was a couple, very nice couple, retired, that walked all around our neighborhood. When my wife and I were on their walks, we used to see them all the time. And then you started seeing them by themselves, the guy, and then the guy. And my wife asked the lady, we walk together, we always see you. She said, well, my husband walks too fast. And it turned out that she had such an issue going on with her veins. After she got treatment, she was able to walk again with her husband. I mean, 30 years they walked every day. Mm-hmm. The husband didn't get any faster, right?
Yeah,
she just got slower.
She got slower
because of venous.
Well, it's hard to know. Was it venous insufficiency or was it arterial insufficiency?
It was for her. It was venous.
Oh, it was venous. Yeah. Okay, yeah. Either one can do it.
Yeah.
Either one can do it.
Wow.
But with arterial insufficiency, another sort of level that we look for is something that we call rest pain. So if somebody has pain even at rest, that means that there is very little blood flow getting down to the leg, and that's sort of a very urgent level that needs to be evaluated immediately. But how much activity, how much muscular activity is required to bring about that pain, which is indicating a lack of oxygen? That's sort of a good sign to us as practitioners to know how urgent it is.
I was talking to a friend of mine who's in the solar business, in the PV business, and there have been some guys that have been working in that for 20, 25 years up on the roofs every day, and some of the problems that they have that prevent them from being able to work anymore are venous conditions. I mean, going up a ladder, it's painful. When they get up there, they can't stay up there as long, and they have the expertise to get the thing installed, but they just don't have the stamina to be able to do it. And that's a game changer, isn't it?
Sure.
Yeah. I mean, not just quality of life, but finance, lose a job.
Exactly. And that can come with either arterial disease or venous disease, either one.
Okay, so there are differences and similarities, but when are the risk factors the same for both the arteries and the veins? With things like diabetes and smoking, obesity, and just generally not being in good shape.
Surprisingly, no.
Interesting. Yeah, that's why I asked that. I was wondering.
The risk factors are very different too. Now, for instance, in venous disease, genetics probably plays the major role. Yeah. Now, genetics play a role in arterial disease too, but there's a lot of other things that kind of play into it. But for venous disease, it's mainly genetics. We also see it in women a little more because of two things: hormonal changes over the course of their life, number one. Number two, pregnancies. Pregnancies are very hard on veins. And then also particularly the point that we've mentioned already, people who have occupations where they're standing all day long. That's a tremendous risk factor for venous insufficiency.
Yeah, and we're talking about worker bees. I mean, and a lot of these folks, they're going to do this for 20 or 30 years, and instead of retiring, they want to work part-time, they want to do something else, but the old body just ain't what it used to be. It's just not going to happen, not going to work.
Right. So, the risk factors, we talked about those already, smoking, diabetes, obesity, cholesterol, et cetera. Those are the risk factors for arterial insufficiency. Those aren't necessarily, well, they aren't. They aren't the risk factors for venous insufficiency.
Okay, so I'm guessing, Doc, that these symptoms that we talked about, the risk factors for the arterial insufficiency, is because there's going to be something that goes through your blood that's really, really bad and will attach itself to the inner walls of this artery, and after a period of time, it'll close it. I mean, or certainly slow it to a point where it can't do what it used to do.
Yeah.
Now, veins, your body invents new veins. When you treat arterial problems, does your body invent new arteries?
Sort of it does. Sort of they do, yeah. For instance, when you develop a blockage in an artery, your body will actually slowly develop something that we call collateral flow, and that is that tiny little arteries kind of open up in between. If an artery is blocked at this point, then tiny little arteries are opened to go past that blockage. We call that collateral flow. It's sort of like if there's a big accident on the highway. Then people get off and go on surface roads to get back on the highway. So very similar. And actually, surprisingly, people can develop that collateral blood flow depending on where it's at. And actually, their symptoms over time can start to improve. And that's one of the conservative ways that sometimes you can treat arterial insufficiency. But getting back to the risk factors for a second, I just wanted to make the point that for arterial insufficiency, those risk factors that we've mentioned, smoking, diabetes, obesity, cholesterol, et cetera, those are all lifestyle changes that we can make. Those all, lifestyle changes can impact those risk factors and can actually lessen your likelihood of developing arterial disease in the future.
Okay.
The same cannot be said for veins, unfortunately.
Wow, yeah. You know what? And we'll get into that, but here's another an incentive. Sometimes if you incentivize somebody for a specific reason, they'll make a life change. And that is, for instance, and I harken back to when we talked about an alcoholic whose doctors told him, look, if you keep doing this, you're going to die. And when he really came to grips with that, he stopped doing it. I think that there are some other things that you can dangle in front of a loved one or yourself if you're listening to this program and find out, God, that's probably why my legs are killing me. Let's do this less, or let's go get some treatment. I think the aha moments here are pretty evident. That must make, as a practitioner, when somebody listens to what you say about the future of their treatment, that this is a major victory if they stop doing one of these things that's one of these other modalities, what you call
Sure.
it.
Yeah, absolutely. And that's, in the realm of arterial insufficiency and arterial disease, that is very, very important, because like I said, there aren't a lot of lifestyle changes that you can make that's going to alter tremendously your ability to make your veins function better.
Okay, I get one dumb question a program. Okay, so this might be.
I thought you've had that already.
No. This is dumber than that. I'm wondering if when you stop some of these more modalities, if you stop smoking, or if you get rid of that type 2 diabetes, can there be any repair in the arteries that were damaged? Maybe they didn't close, maybe they didn't require surgery yet, but can something rinse that stuff out of there, or will it go away on its own, or what's the prognosis of an artery healing a little bit? Probably not good, I'm guessing.
A tiny bit, yes. There have been studies that have shown that if you have a sort of minor blockages in the arteries, sometimes those can regress a little bit if you optimize the things that you are mentioning. But if you have a very significant blockage in an artery, stopping smoking, unfortunately, is not going to make it go away.
Too little, too late. Yeah.
Too late. Yeah. So, so what causes these blockages? That's the next question. And we mentioned before that blockages in the arteries are something that we call plaque.
Mm-hmm. Now, you've heard this in dentistry, and I'm wondering if there's a lot of things that cause plaque. Is it can you have plaque and then worse plaque?
Well, the plaques can grow.
Mm-hmm.
Plaques can grow. A plaque is an accumulation of a number of different things: fat, cholesterol, calcium, fibrin, other cellular debris that gets caught in the artery, in the wall of the artery. Mm-hmm. And typically there's a little defect on the inner lining of an artery for a variety of reasons. I mean, the inner wall of an artery can be scratched the same way we can scratch our skin. And that's typically then the entrance site for these other, molecules and just things to get in and create a space occupying thing that's going to then cause the inner tube of that artery to lessen in diameter and cause impedance of blood flow through that.
Yeah, in other words, the whole thing is a pressure system coming from the heart down to all the way down to when it's this tiny little artery. One question that begs to be asked also, I think, on that is, in that, if you've come to grips with that, and you've come to grips with the fact that, all right, this stuff is going to continue to build up, and so when you do the diagnosis, how evident is it? What's caused? What's the key here? What's the real reason for all that plaque?
Well, the reason for all that plaque are the things that we've mentioned, having to do with the risk factor. For instance, if your lipid molecules and your cholesterol molecules are too high in your blood, then you're going to, that's one of the things that's going to allow for the propensity for you to develop these thickened areas in your arteries. And all of those other things, smoking, high blood pressure, all of those things probably are detrimental to the lining of the artery and maybe creating that initial, tear or defect in the surface that then allows these other things to, move in and create a little blockage.
I'm a big fan of lists, and Dr. Juliff gives me lists all the time. You can find lists on the website as well. That's veinclinicsofhawaii.com. List this stuff out. Unfortunately, when you take a look at the risk factors that we've been talking about here, and the list is this: smoking, diabetes, obesity, a high cholesterol, high blood pressure, age, family history, and high levels of this homocysteine stuff that I don't know what that is, but it's bad. But the reason why is it stands to reason that somebody that does some of these things does more than one of them.
Yeah.
And matter of fact, I know people that have, in this list of A through H,
they're doing every
one of them. Yeah. And so the real factor here is, okay, get away with it when you're 25. When you're 30, you're a bull, or you're, a big, strong gal. Later on, you're not big and you're not strong, and all of these things are going to catch up with you.
Right. Yeah. And these types of things start to happen at a very early age.
Yeah.
The studies have shown that even in teens and possibly even childhood, people, depending on what their diets are like, what their genetics are like, are starting to develop the little plaques in their arteries. That's at a very young age. So, and then you can imagine how things get worse as we get older. We start to do other things like smoking and drinking, etc.
Well, you've said often, and I think the audience, you ought to know this, that Dr. Juliff, being the medical director, sees there's no secrets. I mean, when you get examined by a professional, by a specialist in that area of specialty, they're gonna tell you like it is right away, because that's what they do. That's what they deserve. And so I'm still thinking that, that being said, that it is such a shame that it takes so long for this to develop. Maybe if it developed earlier, some of these people would get healed a lot earlier, and they wouldn't get to be old and all jammed up.
Probably truth to that, yes. Yeah, like so many things. So many things.
Okay, so, but, so far we're looking doom and gloom here. And I'm interested in getting to a point where you're explaining a little bit of how it happens, why it happens, the plaque. Okay, so the plaque starts, and then it's going to be like a beaver building a dam. It's just little by little by little by, it's going to just close that thing off.
Right, right. And at some point, it gets to a level, the blockage becomes bad to the point where it is starting to limit blood flow. So, we live years and years. Since the plaquing can be seen in teenagers, we live years and years with the plaque there, but we're doing fine.
A lot of us listening though, and this is another thing that's on your list, but I'm really curious about it, is and that is that hardening of the arteries. I'm just suffering. I'm getting old. Everybody's arteries get harder.
Yeah, right.
You're making them harder, right?
Yeah, exactly. Yeah, hardening of the arteries is sort of a common term for this process, for plaque buildup, or something that we call atherosclerosis.
Okay.
You know, that's hardening of the arteries. And that's the thing that is ultimately going to limit flow through the artery and cause symptoms and even bigger problems. But the question is then, at what point does a blockage become significant? And if we're looking at it radiographically with an ultrasound machine or an angiogram or whatever, and we have found that the inner, what we call lumen of the artery can actually be impaired up to 70% before people actually start to have symptoms. So
you know what? I'm glad you said that, because if somebody goes to a heart specialist, sometimes they can find out it's a miracle that the thing's even working at all, because sometimes 70-80% is not working. And you mentioned something else earlier, and I want to pound this to all of you smokers, as I can still consider myself a smoker, although it will be 20 years in a month since I've smoked. I still consider myself a smoker because I know how bad that is. If you are a smoker, your lungs are not so good, and there's spots in your lungs, and your lungs aren't. So that means that the wonderful thing called the lung that usually cleans up this stuff to go back into your heart, to get back into your arteries, is not going to do it because it's not working. So what we've got is I guess, the layman's term for me is a domino effect, where the whole thing is falling down because you're doing a silly thing like smoking.
Right, right. But, actually one of the good things about, well, not good thing, but one of the good things about stopping smoking is that your lungs actually will repair themselves over time. So, it's been 20 years and you've had a pretty substantial repair job to your lungs just by the virtue of not smoking. That's one good thing about not smoking.
Let's get one step further. I'm willing to share this. Years ago, I think it was 2001, I needed a hip replacement, osteoarthritis. And one of the things they do is, when you're examining you, is they do a chest X-ray, because they want to see, like in any major surgery, that they want to know how you are, so that how you can recover. And so that said that I had these, it looked like, I think they call them precancerous spots in my lungs. And I think, well, precancerous, I'll just, I'm okay. 6 months later, I had the other hip done, because they can't do it both at once, otherwise you couldn't walk, right? And they said, well, you got these spots on your lungs that you need to get this looked at. Okay, fast forward. That was in 2001. I had quit smoking in 1998. So I'd already not been smoking for 3 years. And they're telling me they have precancerous spots on my lungs. They were old spots. Because fast forward again, I had another major surgery, gastric bypass surgery. The same x-rays you need to have, okay, to see if you can breathe, because you're going to have some breathing difficulties. And the guy said, well, thank goodness you've never smoked.
Really?
Yeah. I'm thinking, wait a minute, this is a bonus day for me. Explain this. I said, I had and they went and looked back in the records, and sure enough, there was a black and white difference in 2 chest x-rays of mine. This is with the spots, and this is with none.
Well, there you go.
There you go. Of course, 20 years.
Yeah.
But what did they say? I mean, we're wandering off point here. But I can tell you that they say a cigarette, some silly thing like it takes 6 minutes off your life. Mm-hmm. Yeah. So a pack a day, 6 minutes times 20, it's a lot. And 30 years, you're dead before you're even 50.
Yeah.
But isn't that interesting?
Well, it is. And it's a great thing. I mean, I think there are a lot of people out there that say, oh, I'm 55, I'm 60 or whatever. I've smoked all my life. What's the use? I may as well just keep smoking. Yeah. But no, there is a benefit to stopping smoking. Absolutely. It's going to get your lungs better, and it's also going to avoid these other complications, one of which is vascular, compromise. Okay, so we get these TV things that they scare you to death about smoking. Great. Unfortunately, I don't see any TV shows that scare you to death about, either an arterial or a venous insufficiency. Maybe because, like you said before, and we keep reiterating, it's hereditary. You're probably going to get it. The problem is that it comes on really slowly, and it may not be symptomatic for what, decades? Many years.
Yeah.
The process occurs over many, many years. Now, with arterial disease, as opposed to venous, which, the sudden changes in your venous status, they don't happen very often unless you develop a blood clot or something like that. However, with arterial problems, you can go from 0 to 60 in the blink of an eye.
Yeah,
and
like
by
a
that,
Ferrari.
yeah. And by that I mean, 1 minute you can be fine, and the next minute you can be having a huge stroke or a huge MI or something like that. So even though, and you have to be concerned about that, even though it's a slow, developing process, it can change, boom, in an instant, and it ruin your entire life.
What is the difference between plaque in your arteries and a blood clot in your vein? Does the arteries get blood clots?
They can, but a plaque in a blood clot in a vein, a plaque in an artery, blood clot in a vein, two totally different things. Yeah.
The reason I ask that is because when we talk about the venous insufficiency, and we talk about clots, and we talk about little pieces of them breaking loose and going into the lung and maybe who knows what, it doesn't seem like any of that happens in the arteries because it's all going downhill.
Well,
or what is the reason?
But actually, it can. Yeah, it can. We call that embolism. We call that emboli when something breaks off and goes somewhere else. So if it's a blood clot in a vein, we have little bits of clots that embolize to the lung, and that's what we call pulmonary emboli. The same thing can happen in the leg, the lower part of the body, where the plaque gets larger and larger. Maybe the surface becomes friable, and little pieces of plaque or calcium can break loose from that area and actually go down into the circulation and can create problems.
I was going to ask about that.
Suddenly, that would be one example of like a sudden change, where you embolize to your foot or your toes or whatever.
What would be something that would contribute to that? Because we've talked about how it's possible to get just in a long airplane flight a blood clot, or having one get a lot worse. And when you're traveling thousands of miles away from home and you don't know what the symptoms are, you are at risk. Is it similar in an arterial condition, rapidly accelerating to be a big problem?
Yeah, well, it's similar in that way, yeah. But, for instance, with DVT, vein clot formation, we know those situations, or we know some of those situations where they're very likely to occur. Immobilization when people are hospitalized, or if they're sick at home, or if they're on a long plane ride or a long car ride, those people are at risk for developing a DVT, venous blood clot. The same cannot be said particularly for arterial plaques that then, break and create emboli that go distally into the arterial circulation.
Earlier when we were talking about, symptoms, I would imagine that when you get a bad set of this going, when you get a lot of plaque going, that these symptoms become real pain, for instance.
Oh, yeah.
I think, I've learned so much from Dr. Juleff, and so will you, by the way, not just what we do here on the radio, but by going to the Vein Clinics of Hawaii website and check it out. There's a lot of things going on in the office. There's some really fun stuff and everything else, but the bottom line is you get diagnosed and treated. The ultrasound, we're going to have an ultrasound operator in here one day, tell you how fabulous the equipment is, and who knows, maybe you're going to change careers and you want to be an ultrasound person. There's lots of opportunities in that. But I'm still thinking that people need to be jogged every now and again. And I guess, don't you have, depending on the bedside manner of a doc, a way to slip this to a patient, saying, look, here's where you are, and we can fix this pretty good, but, to be honest with you, it's going to keep happening unless you do this, that, and the other thing.
Yeah. We have plenty of opportunity to do that, and usually I'm fairly blunt. I don't pull many punches because
I kind of figured that.
It really, you have to be stern in what you're telling people. So many folks out there that they may be long-term smokers, and at some point it just becomes a part of their life, and they make light of the fact that they're doing this stuff to their body. And for those people, you really do have to be blunt to try to change their mind.
I'm not surprised as a practitioner, as a doctor, that Dr. Juleff is saying this. I can tell you that I had every reason to poo-poo and say, well, I like it. And, and it's just, I feel great. I can still run. I can climb up the hill. It's not affecting me. I like it. You tell yourself all these crazy things. Doesn't matter what your abuse is.
No.
You don't like it.
Right.
I mean, in actual fact, every time I lit up, just when I was getting ready to quit, I realized I really don't even like this. I'm such a sucker for this thing. I got to go pick up those cigarettes. I got to go get some more cigarettes.
Yeah, well, you did it the right way.
Yeah.
You came to you made the decision.
Yeah.
It was a firm decision, and that's what people have to do. They have to make that decision.
Well, let's talk about the walk back uphill, because what I said before is, your heart, like a lizard, you lose its tail, grows another one. A vein, you can make some more veins, and you can figure out to make arteries go around. But why would you want to do all that stuff little by when you can make some sweeping changes and have that thing go away?
Sure.
Or at least be manageable.
Right, yeah. Right. Well, and sometimes it's not that easy, especially with arterial. Arterial disease, is a fair bit forgiving, less forgiving. Because
does that mean that the plaque can be dealt with, that you can get in there and do procedures and reduce or eliminate plaques with the vein so the artery can keep working?
Yeah, you can.
Yeah.
But that's only after you might have a major medical event that is going to alter your life. For instance, what are the potential symptoms of arterial disease? And it all depends on what arteries and what organ systems we're talking about. If it's the arteries going to the heart, then those plaques are getting larger and larger. You don't even know it, and sometimes people's first symptom is a major heart attack.
Yeah.
That could alter the rest of their life. Now a lot of people start to have chest pain, and they recognize it. They go to the doctor, they get it evaluated, and they get it treated. Stroke is the same way, though. Yeah. We develop plaque in the arteries going into the brain, and at some point, a little part of a plaque can break off, go into the circulation of the brain, and can cause a major stroke because of the lack of blood and oxygen getting to that part of your brain. So, before the minute before that happened, you had no idea.
You had no idea. See, that's what I was going to ask, and the reason why is when we talk about this, folks, and when you go to veinclinicsofhawaii.com, thank goodness there are ways to differentiate some of the things we're talking about. But the thing that I'm most concerned about is that in my treatment of my venous conditions, we just, get rid of that vein. You seal it off, you do with it. It doesn't look like some of the other ones that you can with your arteries. Isn't that why they develop these wonderful new things that they can put in your heart, in your arteries, these stent things, or these balloons that actually open this thing up again for you. Right. Amazing.
Yeah. And that's another major difference between the two, arterial and venous disease. In many situations, if a vein is not functioning properly, we just close it down, and the other veins take over. But most arteries are not as most arteries are much more essential.
You only have one carotid artery, right?
Exactly.
So take care of it.
Right. So, you have to, in order to treat these things, you have to go in and you have to do something about the plaque to restore blood flow. You have to restore function, not remove function. So
is some of that, and what we said before earlier, that everybody's rushing towards pills, and I'm guessing that some way to control or work on what's in those arteries, maybe down the road there would be something that would say, this is a little scrub-a-dubba. You run this through your heart, it's going to scrub that plaque out of there. Yeah.
I'm sure that medication...
Too late for me, but it might be coming somewhere.
Yeah. I'm sure that medication is being worked on right now.
Oh, yeah.
There's no question about that.
When that would be.
And, when it is found, it's going to be a tremendous advancement. There's no question about that whatsoever. But the next question then is, how do we avoid having major problems? And it kind of gets back to the potential symptoms that a person might be having that might alert them to potential problems with their arteries going to whatever organ system. And do they need to have it evaluated now as opposed to waiting until after they have a huge heart attack or a stroke?
It seems on the surface that even though we haven't really said this yes or no yet, that the problems of the arteries are really serious because they are first of all, they don't grow new ones, and second of all, if they're not working properly and the place that that blood is flowing through, not getting enough blood or enough oxygen, it's a house of cards. It just all fall apart.
Yeah.
So these are the big. You've mentioned some of these already, most of them. A stroke. I mean,
right.
Every time you see somebody that had a stroke, you say, holy smokes, this person's lucky to be alive.
Yeah. And a major stroke can in many cases be the very first symptom of a plaque in the carotid artery, as you mentioned. Somebody may have no symptoms whatsoever that might have alerted them. Now, they might, and with respect to that, one of the kind of signs of a potential problem is a sudden loss of vision of one eye or the other.
Okay.
Something we call amaurosis. That can be a sort of a harbinger of much worse problems that might happen down the line. So, people who have that can get evaluated. They can, we can look at the carotid artery, and often we find the culprit for that, and we can do something about it before they have a huge stroke. So sudden loss of vision is something that you need to be aware of and respond to. Some people will have a fleeting episode of weakness or numbness.
Say like one arm or the other.
Yeah,
right?
One side of the body or the other.
Yeah, that's what I meant.
That's also that's your body telling you something bad might happen in the very near future.
Interesting you say that. The other night on a show that we love to watch called Bull, same thing. This guy Bull, he said my arm's asleep. Doesn't your arm go to sleep sometimes? It's just numb. And sure enough, he had a stroke. Yeah.
So slurred speech. Yeah. If somebody has a very transient episode of slurred speech, that's one of the symptoms that we have to be, cognizant of and act upon if we have it.
Okay, I know one. It's the face. Sometimes they say the facial, one side's drooping.
Yeah.
Or you're slurring your words.
Slurred speech. Yeah.
Yikes.
So, those are all things we have to pay attention to. With respect to the heart, so that's the brain. The brain is the end organ to the arteries that we're talking about. There's also this thing called the heart. It also has its own circulation. And if you're chest pain is an obvious, one. I mean, the chest, the pain that's more on the left side of your chest. Sometimes it goes into the shoulder and the left arm. Shortness of breath. Weakness, dizziness. We're talking about more generalized weakness and dizziness, nausea, sweating. Those are all signs that you might have a heart problem. You need to go have it looked at.
The upside of all of this should be, we're not trying to scare you here, but either you or your loved one are looking at some of these things. And I think the process of elimination is important. So if you have a symptom of some kind, if you think the worst, you might find out, well, it's really not a really big deal, but we can rule out this or we can rule out that. And isn't that what a good examination will reveal?
Sure. Yeah. And often that's how we finally get to the diagnosis. We have to rule out a bunch of other things before we actually get to the root problem.
Well, we were worried before that we weren't going to have enough material to talk about arterial insufficiency and venous insufficiency. The get out of the studio people are knocking on the doors. So we've come to the end of another program. But I think what we really need to get you all to understand is that Dr. Juliff and the staff, and it doesn't matter, you can go to the website and you can schedule an appointment on any island. The quicker you get a look-see, the better you're going to be able to determine what is wrong with you, and more important, what is a treatment program that can be done. So feel free to go and look at the website. That's veinclinicsofhawaii.com, and realize that, you know what, you are in one of the 6 stages. We just got to find out which stage you're in. And don't become a stage 6er without going through the other ones and know what's going on. And that's a really good example, don't you think? Is get in and get identified, find out where you are in the food chain, and decide a program.
Yeah, recognize symptoms and do something about it.
Okay, so the first thing you got to do is get up off your you-know-what and get some exercise, stop smoking, start eating right. And I'm not going to lecture you. You already know what the deal is, and we're all guilty. But it is when you make these lifestyle decisions, and that's what this program is designed to do. So please come and see us at veinclinicsofhawaii.com. See you next time. Tell everybody about it. veinclinicsofhawaii.com. We'll fix you up.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.